Your Houston chiropractor, Dr. Gregory Johnson, and today we have Marie, who came in from watching us on YouTube with a severe hiatal hernia problem that she's been dealing with, as well as a very chronic spine condition that she's been dealing with. And I'm going to show you what we do on her to help her with her hiatal hernia as well as her spine problems. So first thing we're going to do is analyze her posture. So let's do that. Let's close your eyes and flex your head forward and backwards. We're checking her posture first, like we do all of our patients, to make sure we're okay. Back to neutral. Take a deep breath. Let it out. Now you can't see this from the side view, but she's rotated way to the right, so she's been sleeping that way probably most often. Correct? With your head turned this way. Yeah. And you can also see from this view, her left shoulder is way high, and see how her hands are out in front of her rather than being over here on the side. So she's got increased weight bearing from her skull all the way down to the pelvis. So let's have her come over on this table over here first. And we're going to have her laying face down first. There we go. Now, how many surgeries have you had here?
7.
7 back surgeries. So we do not decompress her for that reason, because she's got a lot of scarring in and around the actual nerve openings, the IVFs, where the nerves come out and exit the spine. But she does have pelvic subluxations. You notice her right leg was short there. So I'm starting off with her sacroiliac joints. And those are still pretty sore, aren't they? Yep. There we go. Now, here we're going right straight down on L5. Now these move as a unit down here, even though she has fusion, 360 fusions with instrumentation. These vertebrae move above and below the fusion levels, and the ones that are fused will move as a unit. So I still do a lot of lateral and oblique stretching with this type of patient, and because we need to get her muscles calmed back down again. Now, she had really severe hiatal hernia problems, which is what brought her in the office after watching our YouTube videos on that, several of them actually. In fact, that's probably one of the most common. Okay, now I want you just to breathe normal, and I'll catch you. There you go. Okay, this area right here is very important to line up because the ribs attach to the vertebra here, and the diaphragm attaches to the bottom of the rib cage, and that's what gets weak when it's misaligned here. The stomach slips up through the diaphragm, and that's why you get hiatal hernia, or acid reflux, or GERD. Gastrointestinal problems of many kinds come from this lower thoracic region and lumbar spine region. Now I'm going to put her head down. Let's scoot you all the way up in there. Very good. Now, I want you just to let me have your head. And you see she's starting to get a little dowager's hump right here too, so there we go. That went great. And that went wonderful too. That felt good, didn't it?
Yeah.
That felt good to me even. So see where trigger points. She's got really nasty trigger points in her spine here, so I'm putting some very deep pressure into her trigger points in the trapezius, levator scapula muscles, and rhomboid muscles. Now, see, those are sore, aren't they?
Yeah.
Alright, now I'm going to use a deep vibratory sense genie rub on her lower extremities, and this gets the circulation going and relaxes the muscles. And we get down deep with it too, so we're not just doing rubby feel-goods with this. We're actually digging in on these areas where trigger points are. Right here is the IT band, which a lot of people have problems with, that have pelvic problems or sacroiliac issues. But see, she's had a ton of surgery in here, so she's got a lot of scar tissue, which is the consistency of basically a nylon rope that you would hang clothes on, like a nylon clothes hanger. They used to have clotheslines outside. You don't see too much of that anymore with the advent of electrical dryers. So, but that's what the consistency of scar tissue is. It's very tough, and it makes treatment and rehabilitation of a person who's had these types of surgeries much more difficult, because you have to deal with that scar tissue and break that scar tissue up. And that sometimes can be very painful for the patient, because once you get scar tissue, it is usually weaker than normal uninjured tissue. Now we'll check her leg length again. She's exactly even, and I bet this feels easier to her than the first time.
Yeah.
Much better. Okay, let's turn you on your back now, please.
Oh, you didn't cry.
Yeah. And I'll let you tell the viewers how you feel afterwards. Let's go ahead and get your neck here first.
I feel a lot better.
We're not done yet.
Okay.
We still got some work to do. Okay. There we go. Now just let this go right in my hand here. And same right here. There we go. Now she does have some compression. Now just breathe for me. There you go. Let it all the way out. There it is. Feel that? That separated her occiput from her atlas. Now we're going to get right into this area here, and you can actually see she's swollen right here, right under her rib cage, which is where that hiatal hernia is at. So you find the end of the sternum, and the tip of it's called the xiphoid process. You want to make sure and get below that. Take a deep breath in. Okay, now as she lets her air out, I'm actually getting a grip on the top of the stomach and pulling it back down through the diaphragm. Okay, there we go. Let it all out again, and just keep blowing the air out. This is a very effective technique for treating hiatal hernia. I'm not actually treating the hiatal hernia. We're treating the biomechanical improprieties that cause the hiatal hernia to occur in the first place. There we go. Now we're also going to do a little bit of colon massage here, because you have a valve over here on the left side called the ileocecal valve, and then you also have a valve over here on this side, the left side, that spills in from the colon into the rectum. So she's pretty full. Sometimes patients also that have lower lumbar spine problems will suffer from constipation. I know that's not a very pleasant topic, but I'm sure that she will be able to tell you that she can have a bowel movement usually within the next 12 hours following an adjustment and treatment. And we're working on all the same areas that are supplied to her colon. And now I'm adjusting her pelvis from the front aspect. Let's get her hand right here for a second so we don't pinch that. There we go. Very nice. Here. That's it. And one more on the left ASIS. That's it. Okay. Now let's help you up sideways and face towards your knee. That way. There you go. Good. Okay. Now let's get back this way just a bit. And we're going to check her shoulders. That's moving good, but there was some pain in that, wasn't there?
Yeah.
Like right here.
Yeah.
So you notice I'm pulling the bicipital tendon back, and I'm pulling that in the groove and adjusting her right shoulder. Yep, it's grinding already, and that's painful right there. Deep breaths. There you go. Excellent. That's better. Okay, now just let me have this one. There we go. Excellent. Now let's get your elbows in your wrists. Perfect. Okay, just relax this. There. Now I'm going to be lining up her carpals with my left hand and then stretching and pulling these away. So I'm squeezing the carpal bones and the radius and ulna together, and then opening that joint up in there. And we do the same thing on that. Just let this one go because I know this wrist is out. There it is. Perfect. Excellent. Very good. Now, Would you mind telling our viewers how you've done with the hiatal hernia after I do this procedure on you?
Oh, I'm doing a lot much better than before I came here. So that's why I chose Dr. Gregory.
Well, thank you very much, and we're happy to help her, not only with her hiatal hernia, but her spinal problems as well. And we're trying to avoid any future surgeries. This is your Houston chiropractor. We'll see you next time.